enriching. I believe this conference will provide you with yet another opportunity to exchange information on current development and development of potential approaches to scaling up innovative technologies that will accelerate the attainment of the SDGs. Honorable Chairperson, distinguished delegates, science and technology is an important and vital tool in addressing fundamental gaps in the health sector. I wish to commend the organizers for the timely and relevant selection of the theme, which says, Technology for Health Systems Transformation and Attainment of the UN Sustainable Development Goals. This theme comes at an opportune moment as the world is in its fourth industrial revolution, where science and technology is taking the lead in all aspects. You will agree with me that sustainable development is elusive if we do not invest in fit-for-purpose technologies in order to help our countries to generate answers and solutions to many public health problems and challenges. And I wish to underscore that the need to invest in digital health technology cannot be understated if we are to fully implement the Sustainable Development Goals and address all aspects of poverty. We can no longer ignore the direct correlation of poverty and social vulnerability in aggravating poor health. Therefore, in order to address these vulnerabilities, we need to invest in digital health or digital health technology as a way of strengthening regional healthcare services. We in Tanzania have been able to identify that, and we have already embarked in digitizing our healthcare systems through our Ministry of Health and the several agencies under them, such as MSD, whereby digitized technology helps us in tracking the consignment from purchase point to delivery point. In national health, into what is happening at our agencies or agencies level, we have installed hospital management system in all government hospitals. This system gives real data or real-time data, and you can track the movement of the patient and the medicine stock. So we have tried and will continue to do it. We have recorded positive impact of our health, the medication, etc. And number two, we experience improved efficiency and time saving. Number three, there is availability of real-time data for better decision making. Number four, we have improved resource tracking and allocation bills. One of the gains that is, which the doctors over there are using the digital and telemedicine. So whenever a problem happens, they just go in the mtandao, and then they ask the fellow doctors, how can I go through this? And they're advised through mitandaos, and then the solution is being obtained. So our challenges still remain in having adequate manpower to support these ICT initiatives and funds to train new manpower and come up with the new initiatives. But I believe the discussions you will have today will share on our best practices and how you can cooperate with each other in scaling up digitized transformation in the region's healthcare sector. Honorable Chairperson, distinguished delegates, I'm made aware that today, in addition to the East African Health and Scientific Conference, the East African Health Research Commission has established new platforms that are meant to share research findings in the region, to build research capacity, and to create a better environment for research on health matters. Now allow me to mention a few recommendations of the conference and to prepare for the next one. 2, the Commission has established an official comprehensive compendium of health information in East Africa, which is a one-stop center for health information. It is operational through a web portal. Whoever wants it, I have it, I'll give it to him, which will be launched during this ceremony. And number 3, the Commission operationalized 2 scientific journals that are contributing to share with the global scientific community the scientific work part of the East African Community region. And number 4, the Commission established the Young East African Health Research Scientists, Forum, which is an initiative aiming to empower East African community young researchers to be able to shape the future of research for health in the region. This initiative was approved by the 15th East African Council of Ministers Forum. EAS Forum will also launch during this ceremony. I'm told that there will be launching of the Young Researchers Forum. But number 5, the Commission initiated a number of other regional programs and projects that are running as they have been presented by the Deputy Secretary General here. So I therefore take this opportunity to congratulate all members of the Commission from partner states and East African Health Research Commission Secretariat for the tremendous achievements and encourage them to keep up the speed and the commitment. Mr. Chairperson, honorable ministers and distinguished delegates, the approval of the Digital Regional East African Community Health or Digital Reach 10-year strategic plan by the Sectoral Council of Ministers of Health held in Kigali on 26 October last year is an important step towards achieving transformation in this sector. I expect that Digital Reach will support the development and implementation of regional health programs within existing East African community regional policies and legal frameworks as provided by the treaty establishing the East African Community and as desired by each of the EAC partner states. I'm informed also that this initiative will build infrastructure and other digital health assets that can be used directly by each country for their own national programs implementation. It has been developed based on collaboration and inputs from representatives of the EAC partner states and in support by respective organs of the EAC. However, effective implementation of this regional initiative depends not only good coordination from the East African Health Research Commission, but also a strong commitment of East African partner states, development partners, and every health sector stakeholder in partner states. And so I take this opportunity, therefore, to call upon our development partners to continue their support to the East African Health Research Commission and partner states to implement and coordinate this initiative. Honorable Chairperson and distinguished delegates, as we discuss the above-mentioned revolutionary and innovative initiative, we must strive to put up mechanisms that support and accelerate its implementation in health sector. I'm informed that all EAC partner states are now implementing digital health initiatives that need to be supported. We should not forget, however, that the effective integration of the EAC partner states, they need to be regionally of health systems, which are service delivery, health workforce, health information systems, access to essential medicines, financing and leadership or governance. The ministers have made their promises here when they were delivering their speeches, and I would like to encourage partner states to support the new development in East African partner states and call upon them to work together through digital health technology. And as I'm coming from Tanzania, I take the liberty to reiterate the commitment of the United Republic of Tanzania to take advantage of digital health technology to improve implementation of health interventions. We have started implementing some programs, and we continue to digitalize health services with the aim of accelerating attainment of the universal health coverage and SDGs. Honorable Chairperson and distinguished delegates, we realize, however, that digital healthcare initiative to achieve the SDGs have inherent challenges that go beyond the implementation of technology. These challenges include, among others, the need for a trained workforce that can be skilled in using digital health solutions, and the need for proper governance and funding, among others. And now, to overcome these barriers, we need to take an interdisciplinary and intersectoral approach, bringing together all the main actors in the digital health ecosystem, such as international organizations, health services institutions, academia, research institutions and research centers, and public and private industries. We need to align our digital health approaches and solutions with the specific needs of countries' health system and the region. We need to define and implement digital health strategic plans which consider governance mechanism in digital health. Our national strategies and policies need to be developed and aligned together to ensure intersectoral cooperation. And I need to insist this, that we need to define and implement digital health strategic plans which consider governance mechanism in digital health. Our national strategies and policies need to develop and align together to ensure intersectoral cooperation. Therefore, our academia and research centers and institutions are expected to continuously develop and produce primary evidence that helps decision makers identify the best, most cost-effective solution from the wide range of options available in digital health. The public and private industry, which is revolutionizing the digital health sector, should consider national and regional health realities and priorities, and offer sustainable, needs-oriented solutions in specific social, cultural, and social health realities in line with resources available in the context. And this underlines the urgency of supporting the Digital Reach initiative, which is designed to complement, improve, and strengthen East African partner state-specific work in digital health. Let us not lose this opportunity to boost the attainment of SDGs for our community. As for our experts gathered here today, the community expects much from you. We expect concrete, simple, and cost-effective actions with high impact that East African partner states can undertake at national level or collectively as a region. Honorable Chairperson and distinguished delegates, before I conclude my remarks, let me once again welcome all international delegates to Tanzania of how you value East African cooperation in health, research, and science. My appreciation would not be complete if I don't thank all members of the diplomatic community, development partners, members of the East African Legislative Assemblies, presenters of various scientific papers invited to this conference, and all those who have put in time and efforts to ensure the success of this conference. I wish to conclude my remarks by thanking you all for attending, and for those who are coming outside Tanzania, and if you will manage to get some few days, I hope you will enjoy exploring the beauty of our country. I particularly recommend our sandy beaches in Zanzibar, which is only 25 minutes by air from here, and 1.5 hours by boat to Zanzibar, speedboat to Zanzibar. But also I recommend our picturesque Kilimanjaro mountain, and not forgetting the renowned Serengeti and Ngorongoro National Parks. They're just here. Yeah, you take time and go and visit. Instead of going back and look for another ticket to come to Tanzania, use this opportunity. Having said that, I wish you fruitful deliberations. God bless this conference and bless us all. Mr. Chairperson, distinguished delegates, it is now my singular honor and pleasure to declare that the 7th East African Health and Scientific Conference is now officially opened. I thank you for your kind attention. Thank you very much. Sorry, for the benefits of the media fraternity, nimeambiwa niseme Kiswahili. Naomba mkae. Kwa waandishi wa habari, mkutano wetu leo madhumuni yake ni umekusanyisha hapa wadau wote wa sekta za afya ndani ya East Africa. Digitali, utaalamu wa kisasa, matumizi ya digitali katika sekta ya afya. Hapa watabadilishana mawazo, nani anafanya nini katika nchi zao. Tanzania, nimeanza kusema hapa nini tunafanya ndani ya Tanzania, lakini tunahitaji kufanya makubwa zaidi. Kwa sababu maendeleo jinsi yanavyokwenda na tunavyoelekea kwenye chumi za kati kutoka kwenye chumi za chini, lazima tuwe na watu wenye afya, lazima tuwe na sekta ya afya inayotoa huduma kwa haraka na kwa uhakika na kwa wakati. Kwa hiyo wanachofanya hapa ni kuangalia vipi wao kama East Africa, nchi za East Africa wanafanya, lakini kuna changamoto zipi, what are the possible solutions, kuna suluhu zipi au utatuzi gani utapatikana ndani ya mkutano huu, na baadaye watatuandikia ripoti yao, na ni juu yetu wakuu wa nchi za East Africa kuyachukua yale na kuyafanyia kazi kwa faida ya watu wetu. Kwa kilichoko hapa ni utaalamu wa afya na jinsi ya kuukuza utaalamu ule wa afya. Nadhani imetosheleza. Asanteni sana.
Yes, we're digitizing the torches now, the flames of Africa. Distinguished ladies and gentlemen, as you understand, this conference is biennial and it's on a rotational basis. It's now in Tanzania, and so for the next 2-3 days, we're going to light the torch so that your thoughts, ideas, everything that comes through is illuminated by the guest of honor. And then we'll light it out on the final day before we pick it up for the next rotational member state. And so we'll begin with that. And just before we continue, I have a band of young boys and girls who represent the 6 countries. They have the flags. May I please request you to come up onto the stage? Kuna vijana 6 ambao wana bendera ya Jumuiya ya Afrika Mashariki. Hawa watakuwa washereheshaji wa matukio mbalimbali ambayo atayafanya mgeni wetu rasmi. Bendi, tafadhali. Mabibi na mabwana, na sasa mgeni wetu rasmi, our guest of honor, anatuwashia tochi yetu ya kikao hiki. There we go. Asante sana. Makofi mengi sana. Asante. The torch is lit. Please take your seat. Naomba nikukaribishe katika kiti chako tafadhali. Let's take our seats, ladies and gentlemen. Vijana wamependeza? Wamependeza sio eh? Aya, sawa. Mabibi na bwana katika meza kuu, please take your seats. Your Excellency, distinguished ladies and gentlemen, within the speech of the guest of honor, she did mention the various articles that we'll be launching right now. Number 1 is the Digital Reach Initiative Strategic Plan 2019-2028. It will be followed by the official, which will be a booklet. It will be followed by the official launch of the East Africa Web Portal for Health Information. And the guest of honor will once again experience a digitized button that will immediately bring up the portal onto the screens. She will do it from the podium. The book will be done where she's seated, probably standing. And finally, we'll officially launch the Years Forum. And that will bring together the 20 young scientists, PhD level scientists who will come up onto the stage and receive trophies as a form of acknowledgement. But to explain all of that, may I please welcome the Executive Secretary, EACHRC, Professor Kibiki, to assist me in leading the ceremonies. Karibu sana. So let's begin with the Digital Reach Initiative Strategic Plan 2019-2028. What is it about?
Thank you, Your Excellency, honorable guests, distinguished guests, ladies and gentlemen. Given the opening speech that Our Excellency Samia Suluhu Hassan, the Vice President of the United Republic of Tanzania, that she has just delivered, there isn't much to say about digital reach. We have heard enough, and as from the Commission, we have taken note of all the comments you have made, and we guarantee you we're going to implement. Suffice to say that the directives that we are given, that we should start mobilizing resources and implementing this initiative, we are ready to start doing that. We have gone at different stages in forms of resource mobilization and developing programs that we're going to implement under the Digital Reach Initiative. We are excited with how fast this field of digital health is moving. Last November, for some of you, you may have noted that in India, a doctor who was 1,000 kilometers away from the patient, he was able to do an open heart surgery using tele-robotic surgery, and it was successful without a physical presence of that doctor. We may not dream to go there today, but it truly, out there in remote areas, they need specialized services. And we know that we do not have enough specialists to go out there. If you look the map of distribution of the ratio, doctor to patients ratio that is seen in Africa is red, meaning that we have a gap to cover. We are not to do this within a short time by purely using our academia to train more doctors. This technology offers us an opportunity that we can start reaching them, even if it means just to interpret a chest X-ray or CT scan. We want to mobilize these efforts to be for the region. With this I'm humbly, Your Excellency, I humbly welcome you to officially launch the Coastal Digital Regional East African Community Health Initiative, a strategic plan of 10 years, starting from 2019 to 2028. You are welcome. Thank you.
May I please request that we be standing at the head table? Please, first of all, receive the strategic booklet, strategic plan, and the scissors. You're seated next to Mheshimiwa Umi, amezoea sana uzinduzi wa mambo kama haya, atakuelekeza kukata wa utepe. Lakini na mimi nitatangaza the official launch of the Digital Reach Initiative Strategic Plan 2019-2028. Please display it for the media to take a picture. We're now going to go to the next launch. You may please take your seats, but I will request the guest of honor to approach the podium, please. Nitamwomba Mheshimiwa mgeni rasmi pekee aje katika podium hapa ili abonyeze kitufe kuzindua tovuti. And so now we're launching the East Africa web portal for health information.
Where is it?
Hii ina kitufe maalum ambacho unakibonyeza mara moja kinakuwa nyekundu, halafu inajionyesha.
Okay.
Please go ahead.
1, 2, 3, here.
Yes. Yes, tired. And there it is. Technology is here to see. Yes, there it is. There it is.
She's not seeing.
Yes, maybe actually.
Oh, okay. Yeah. Here it is. Done?
That's a very special button. It's called the link share. It allows you to not fiddle with too many buttons, but just a single button will project a couple of computers or working computers in a room so that everybody can share something that they have on their laptop. Great way to go. And so, Professor Kibiki, once again, we've launched the East Africa Web Portal for Health Information. What does it contain? Would you quickly make a summary?
So, thank you very much, Your Excellency. And let me take you through only a few pages to show what, and unfortunately we have only one screen behind here that will be able to show the contents, but otherwise there's a looped screen outside which is showing the main features. So this is a comprehensive compendium of health information in East Africa, where we have tried to put as much information as we can so that it becomes a one-stop center when you're searching for health information. And you find it directly, or you'll be directed where you can get more detail. The home page, which is here, it has 5 key features: the portal key resource, the health directory, which we are making ourselves based on the verified data from the ministries of health and other ministries. We have the health indicators, and we have gone further down to level 1, that is regional, and in the future to district level, of which the WHO does not have that information. We have health A to Z, which is, in fact, if you are, say, coughing at home and you wonder what to do, this web can help you at least to take the first steps before you go to see your physician. And of course, we have also a platform for the 2 journals that we are running, which are meant really to build capacity for our scientists in the region, but also to showcase the research work in health that is done in the region. And the scientific conference as well, based on the theme and where it is, we're going to be updating as such. There is information for each partner state. You can click there and you get info. Of course, most importantly, our leaders there also are there and you get an opportunity to go through there. We provide also news updates, latest news, etc. Now, within the partner states, we have chosen a few parameters. If you look for Burundi,